Auscultation, it gives important information about the bowel motility. So I have to look for change in sound that suggests peritoneal inflammation, obstructions, and bruits. Now I'm going to check the sound in order quadrant. Then the epigastrium. I'm going to check for bruits in the aorta. Then the iliac arteries. Then in the femoral arteries. Then for frictional rubs in the liver and in the spleen. For percussion to assess the amount of gas in the abdomen, I'm going to percuss in all the quadrants. Checking for tympani to dullness. Now I'm going to percuss for liver to measure the vertical span of the liver dullness. So from the right mid-clavicular line, I'm going to start at the level below the umbilicus and percuss upward towards the liver. It is to identify the lower border of the dullness in a mid-clavicular line. Now the same thing, from the nipple line, I'm going to percuss downward. Okay. So normally, the distance between the upper border and the lower border of dullness in a mid-clavicular line is normally it is 6 to 12 centimeter. In the right mid-clavicular line and in the sternal angle, and in the mid-sternal line, it is usually 4 to 8 centimeter. I'm going to perform palpitations of the liver. I'm going to put my left hand behind the patient's, supporting the 11 and the 12 ribs. I'm going to slightly press it upward. And with my right hand, I'm going to palpate the liver edges. Can you please breathe in? Breathe in, please. Breathe in, please. Okay. I'm going to place both my hands side by side below the border of the liver dullness. Can you please breathe in? Breathe in, please. This is called the hooking technique. Of the spleen, from the cardiac dullness of 6th rib to the anterior axillary line and to the costal margin. I'm going to percuss it. If tympani is more prominent, then there is no spleen enlargement. Okay. Can you please breathe in? Okay. I'm going to palpate the spleen. I'm going to put my left hand over here, and then with my right hand I'm going to palpate the spleen. Can you please breathe in? Breathe in, please. Please. Okay, can you please lay on your right side? Okay, flex your leg a bit. Can you please breathe in? Once more. Once more. Okay, thank you. Perform palpitations of the kidney. Usually kidneys are retroperitoneal, so they are usually not that palpable. So I'm going to put my left hand here at the 12 ribs, leave up, and then I'm going to palpate from the upper, on the left upper quadrant. Can you please breathe in? Okay, thank you. Palpitations of the right kidney. I'm going to support this one. Then, can you please breathe in? Breathe in, please. This on the right upper quadrant. Okay, thank you. Bladder. The bladder are not usually palpable unless it is distended above the symphysis pubis. And for the aorta, I'm going to press firmly on the epigastrum area on the left side of the midline. Can you please breathe in? Small. Okay, thank you. Palpitation of the kidney.